I think probably historically people would always kind of see obesity simply as excess body fat. That was a kind of historic understanding. We've recently, though, kind of gone through a phase where people have been debating whether or not we should think of this as a disease. And there are many people in favor of that. There are lots of other people who kind of are not totally comfortable with it for various reasons and maybe see it more as a risk factor. And I kind of see some sort of strength on both sides.
Hello and welcome to the Pet Food Science podcast brought to you by Wise Medics. My name is Jan Sobolewski. I'm here a professor at Texas University. I'm dedicated to bringing you the latest insights and discussions in the pet food science industry. So get ready to expand your knowledge and stay ahead with today's episode. And today's episode, we're going to talk about obesity, and it's a very great honor to have Professor Dr. Alex German, who is a real expert in obesity research, as our guest. Welcome, Alex.
Well, thank you very much. It's absolutely great to be here.
Yeah, Alex and I know each other for a long time because he started being a GI researcher and then he moved in obesity. So, Alex, what I usually like is try to let my guests introduce themselves. We have a wide audience from ranging industry to graduate students, so it's nice to see where somebody started and then how career choices led you to somewhere. So the stage is yours.
Well, thank you, and it is lovely to be here. It really is. So I'm Alex German. I'm a vet by training, qualified a long time ago. I'm not going to say how long, but after my vet degree, I did a little bit of time in practice, and then I actually then undertook a PhD, which was in gastroenterology, and that was my passion at the time. I also did some residency training, so I'm specialised in internal medicine, veterinary internal medicine. It was about 25 years ago when my residency was coming to an end that I kind of needed a new direction. I needed a new job as well, of course. So I moved to Liverpool at that time. And my interest from that point on shifted to studying obesity, both from a clinical perspective and looking at a lot of the kind of research angles. The main reason for that, if I'm being totally honest, was a pragmatic one. When I was at Bristol, there was a great team of researchers, particularly on the immunology field, that I had the opportunity of working with. There wasn't the same expertise at Liverpool, but it just so happened they had great expertise in obesity, particularly on the human side, with the first obesity biology professor in the UK. And I guess the rest is history. I've continued since then. And probably aren't going to go back.
Just maybe for you are currently the role-keeping professor of small animal medicine, University of Liverpool.
Yes. Correct.
And you currently, is it also you do internal medicine or so, and have an obesity clinic kind of, or what is kind of your schedule at the moment?
Sure. So as with a lot of academics, I do a lot of different things with my time. I do still work on the internal medicine clinics. So I spend about a third of my time on there. And I think it's important, as we'll hopefully come to discuss. I think obesity should be very much seen as a medical disease, although we're talking nutrition and our treatments principally at the moment are nutrition. I think that angle from the sort of internal medicine side, I think very much helps. When I get an opportunity to do research, then the topic I say I mainly focus on is obesity. And the main driver of that, as you say, is we have a specialist obesity clinic at the Liverpool hospital, which actually this year we're celebrating our 20th anniversary. Feels like only yesterday I started it, but there you go.
That's great. And I have seen my records that it's almost like you have more than 700 cases over the last 20 years, correct?
Yes, that's. So it's probably 2/3 dog, 1/3 cat. We don't yet do other species. I think I probably need other colleagues to help me with that.
So let me ask a question. So we're going to talk about obesity today, right? As you mentioned, medical condition. We're going to talk about your clinic. So maybe like a start broad, what is the latest kind of thinking? What's the latest insights? What's the definition? What's the understanding of obesity?
Sure. That's a great question. And actually, it just so happens, I think a lot of the understanding of obesity is shifting, particularly in the human side. And as with lots of disciplines, we tend on the vet side to kind of follow what they do. I think probably historically people would always kind of see obesity simply as excess body fat. That was a kind of historic understanding. We've recently, though, kind of gone through a phase where people have been debating whether or not we should think of this as a disease. And there are many people in favor of that. There are lots of other people who kind of are not totally comfortable with it for various reasons and maybe see it more as a risk factor. And I kind of see some sort of strength on both sides. As of the beginning of this year, there was a report in the human side by a commission set up by the Lancet the Lancet Journal. They basically got a panel of international experts to kind of look at definitions and the diagnosis. And I do genuinely feel we're now into kind of a new phase. I guess the main thrust of that work is a recommendation to classify cases of obesity on the basis as to whether they have clinical obesity or whether they're preclinical. So this is the kind of current recommendation. A preclinical case typically has excess body fat, and that was, where we started historically. But when it's clinical, it's kind of recognizing there are consequences, direct consequences to health from that fat. And I think that's kind of where things are at the moment. So to me, I think we're kind of moving forward, and I've made some recommendations recently in the veterinary field that we should kind of adopt similar sorts of definitions.
So the clinical means we have metabolic syndrome, or also like the consequences in general of obesity. Can you give us a few examples?
That's an excellent question. So I guess one of the things the panel were trying to do was resolve this debate about whether it should be a disease or a risk factor. And their answer was it can be a disease, but sometimes it isn't, depending on the circumstances. So they kind of hedged it. For the clinical obesity, the emphasis is that the consequences are directly arising from body fat. So you can have metabolic changes, you would say. You can also have various other signs. They've recognized things like knee pain, sleep apnea, which are direct consequences of having too much fat. You can separately have other consequences which are indirect, and that's where the obesity is acting as a risk factor. So, for example, if the obesity then leads to diabetes, then that's kind of a separate indirect consequence. It's not technically part of the clinical obesity bit because you can't define one disease on the presence of another disease. So I guess there's a recognition now that when you have the excess fat, some people are unaffected, some animals are unaffected. So they have the preclinical obesity. Others may have direct consequences from the fat. That's where the clinical obesity comes in. And then there's a recognition if obesity is acting indirectly as a risk factor, then it's contributing to other illnesses, if that makes sense. It does make sense, but it seems more complicated, but there's some logic, I think, to it as well.
But can you give us maybe a few major areas where you think we could classify them, right? So maybe the metabolic syndrome, but give me just a few examples for each of those stages, kind of that veterinarians or even owners should be aware of.
And certainly for dogs and cats. So we, as with some colleagues after the Lancet paper came out, we did actually publish a piece in the Veterinary Record where we kind of made some suggestions. So similarities and differences. The first thing you'd have to do as a vet is decide, is there excess body fat? And the most common way that a vet would do that would be with a body condition score. And hopefully most people are familiar. We typically use a 9-point system. That's the preferred system now. And typically kind of 8 out of 9, 9 out of 9 on that system, the top of it would be obesity. So that'd be kind of a essentially knowing obesity is present. From the point of view then of deciding whether it's clinical or not, there are lots of things as a vet we could, for example, look for. Probably the most obvious things are changes to mobility. So if an owner is noticing their dog is less able to kind of run or jump than would be typical, maybe noticing a change in the way they're moving the gait, so kind of a more waddly type of pattern, that kind of thing. Those sort of things would be one of the kind of things where we would say that's a direct consequence of the body fat. If you take blood tests, you can sometimes see some metabolic changes that go hand in hand with excess fat. So sometimes slight increases in glucose, increases in things like cholesterol, triglycerides and things as well. Now those are kind of short of diabetes. So effectively you can decide, those are kind of a couple of examples of the kind of clinical side. If, for example, the patient also has diabetes and they have obesity, then obviously that could then suggest that maybe the obesity instead has acted as a risk factor. So I hope that makes some sense.
When you mentioned the body condition score chart, right? My experience is I'm coming more from GI world, is but that many veterinarians don't use it. I think many veterinarians don't even know about it. So
sure.
How can we really start education? Because I think that's probably an important part, earlier recognition, correct? So do you have any resources, veterinarians, but also owners, could access those kind of materials?
Mm-hmm. I agree with you. I think one of the challenges always is getting people to actually hopefully use the tools we've got. We did just an aside, I did a study a number of years ago where we actually looked at how often vets took body weight and did a body condition score, just in a kind of group of cases, and actually it was uncommon. So it's about one in 3 or 1 in 4 occasions a body weight would be taken, and obviously for me body weight's a real key metric. Body condition score was quite rare in that time. Now that was probably 15 years ago now, and actually it is a lot better. But I do agree there's a need for us to kind of to try to, if possible, get a vet to take a weight and a condition score every single time, and also add muscle condition on to that as well. There are resources already available, so perhaps it is a question just of education, teaching our students whenever we talk about anything in practice, including those as part of the kind of metrics you need to look at. Probably the easiest resources, if people are interested, would be to go to the WSAVA website, wsava.org, and they've got a great set of toolkits there, including body condition score, muscle condition score, and other metrics, which effectively, for me, would be the sort of starting point. But what's ironic is that these metrics don't take long to do. It takes a second or two to do a body weight. About similar length of time to do body condition score, and similar for muscle condition score. Yet they're very, very useful, particularly when it comes to kind of long-term monitoring of health in any individual. They're really, really helpful metrics to have.
So to kind of summarize or to kind of emphasize, every veterinarian at every examination, you should do those scores for your records, correct?
I would say yes.
And also I know that many pet food companies, I think veterinarians could ask the pet food companies, they usually have records and so on, and online resources of those body conditions on top of obviously WSAVA. Right?
Agreed. Yeah.
That's good. Mm-hmm. So once we have this stage, right, so what do you do so let's assume you have this, you see these animals over time, right? They're getting more and more obese. What would you recommend? When is the intervention? What's the first line of intervention?
That's a great question. I could tell you what would be perfect, and then I'll tell you about the kind of reality. Okay. To be honest, I think we should be spending much more time preventing obesity rather than managing it, if at all possible. But really, to do that optimally, you've got to do that right from the first ever consultation. So the first time a puppy or kitten goes to a vet, that would be where you would start. And at that point, that we've developed some really useful resources. So we've developed growth charts for both puppies and kittens, again, they're freely available online. And we can share a link perhaps if people are interested. But that effectively means that what you can do is take regular body weight checks through the growth phase, and you can actually then plot how a particular individual is developing relative to a standard, i.e. what we would think a healthy puppy or kitten of that same sex, same size, same breed, as it were, should in fact be following. So you can say, are they growing too quickly? Are they growing too slowly? And you can make adjustments. By doing that during the growth phase, any earlier issues can be spotted, particularly around the time of neutering, because that's often the time where energy requirements and activity levels and things change, and sometimes nutrition needs to be adjusted. But if you can then get them to their early kind of adulthood at a perfect body condition, then actually for me, that kind of weight they are when they first turn an adult would be a kind of metric I would then record and follow. And then moving forward, if you can, every sort of 6 months or so, reweighing and just checking against that standard you set against their kind of healthy weight, as it were. And any deviation, 5% or more, for me would require a quick check. Why has that happened? But also perhaps some adjustments to food. That's my perfect. That would be what I would like. More often than not, obviously, animals come along and they're already overweight, in which case that's sometimes when you need to think about a kind of more of a sort of set program.
Can I just take one step back, just as a quick, what is adulthood? When is the kind of the phase for like small breed, large breed? What's kind of the age?
Sure. It's a very good question, and it varies, of course, depending on species and breed. The more I've been using our growth charts, actually, a lot of breeds are probably adulthood by kind of 10, 11 months, certainly by 12 months of age in a young and many kind of medium-sized breeds, for example, and likewise in cats. For giant breed dogs, of course, that can be somewhat later, so sometimes upwards of 18 months. Again, it can vary quite a bit, and it can vary within an individual. One of the beauties, if anything, of using a chart, though, a growth chart, is you actually naturally see the kind of the weight tapering off, again, according to the curves. And so you can kind of spot that point for an individual. But certainly, I think probably by most dogs, between 18 months and 2 years of age, they'll definitely have reached adulthood. So if you want to kind of know what weight, if I'm not sure, I would say at 2 years of age, record the body weight there, check their body condition score if they're in ideal. That again would be my kind of healthy adult weight to kind of follow.
And you think, or is there data that this is a good predictor how they're going to do later in life, this time point, or why do you think that should be the optimal time point?
So there's certainly some data to suggest that the kind of rates of growth, i.e. too rapid, ideal, kind of, and so on, are associated with risk of things like obesity. So for example, a kitten or a puppy that grows too quickly and therefore gets too heavy by the time they enter adulthood is more likely then to remain in overweight condition and actually almost gradually gain further weight as they go through their life. So there's certainly evidence for that. I don't have any proof that, for example, setting a healthy weight, as I've said, and regular monitoring will prevent any problems from occurring. I think there's certainly some evidence in people that regular weight checks are associated with better weight outcomes. So individuals who weigh themselves very regularly are less likely to be overweight in the first place. They're more likely to succeed with any diet plan, and they're more likely to keep any weight off after losing it. So I think regular weighing, certainly in humans, has some merit. We still probably need to prove that, I guess, in dogs and cats.
So let's assume now you said now that was the ideal, right? Now we come to this point where actually most of obesity. So what is the most newest insights into obesity care?
Okay, good question. Yes, so that'd be the situation where let's imagine an animal has gained weight, you've not been able to follow them and prevent it, and it's obviously inevitable. Newest insights. Well, one of the things I guess for me is the overall strategy for an individual. So I'm going to talk about some of the types of treatments maybe in a moment and some of the future there. But in terms of strategy, if you come back to that classifying individuals based on have they got clinical obesity and making sure you've fully classified any other diseases, anything like diabetes where there's a risk factor, I would use those to set my goals for any particular obesity care plan. I tend to prefer the term obesity care to traditionally we'd say weight management. But weight management makes it sound very, matter of fact, very mathematical, and it's simply about there's an animal has a certain weight and we're trying to get into a different weight. Whereas I think we've got to kind of look at all of those aspects. And let's take an example. A dog's got obesity and they've got mobility problems, and you've identified that, by checking with an owner. My primary goal nowadays would be to make them more mobile. So it's kind of improving their quality of life, improving their health. And by knowing that, I would then know how much weight maybe they would need to lose. And then I kind of, so if anything, the plan follows the ultimate goal. And I'll give you kind of two examples of how you can do that. If there is evidence that dogs that remain at ideal weight are more likely to live longer on average. There's reasonably good scientific evidence for that. So if I had if that was my primary goal, let's imagine I want an animal to live there, I'd need to get to them as young as possible to get them to lose weight, because obviously the longer their life they've got, the greater the impact. And I'd want to make sure I returned their body weight to a kind of perfect weight, where they were back to a kind of condition score 5 out of 9 from where they've gone to. On the other hand, if mobility is a primary outcome, a primary goal, the good news is individuals don't need to lose too much weight in order to see that benefit. In fact, only about 6% weight and owners will start to spot a difference. So let's take an animal that's kind of 8 or 9 years of age now, and they've got arthritis and they've got mobility problems there. There's little point in me saying I want to get them back to their kind of perfect weight, because they're not going to live a great deal longer. But I know a small amount of weight loss beyond 6%, and they're going to be starting to be more mobile and happier. So that I guess is one of the things in terms of how things have changed. I think a greater understanding in recognition of the fact that we're dealing with a clinical condition, a medical condition, a greater understanding of what's driving what we do is the goals rather than just the numbers of weight, if that makes sense.
Absolutely.
I guess the other aspect of what's changing is up until now, the principal approach we've taken is using a therapeutic diet for weight loss. And I see that as continuing, but not far around the corner, it's likely that there's going to be some drug therapies for obesity as well.
And which direction are we going? Which drug?
So basically, obviously people should be aware by now you've got GLP-1 agonists for people. So that various drugs are available for humans. And I'm aware of people kind of beginning to want to try them out, particularly for dogs. I suspect we'll probably go dogs in the first instance and then think about cats after. Cats are always more of a problem. The difference that they'll bring is that they principally work by affecting appetite. So our current therapeutic diets, a lot of the way they work is to try to effectively make a dog or cat feel full. So we typically have very high protein and high fiber, and that way when they consume the food, they get fuller. And in a diet, we typically would need to work out how much to feed, and we feed about half as much or 60% as much as they need, recognizing they feel hungry, and hopefully that higher fiber will kind of offset their hunger. if and when drug therapies come about, the types of diet that we would use are likely to change. We'll still need diets in my mind. And the reason for that is that you need to ensure an animal loses weight safely. So you want to take the calories away, but you need to be sure that they're going to be consuming enough essential nutrients, vitamins, minerals, amino acids. So our current diets are designed to do that, I say, already. But if you take a kind of standard dog food and you give them a dog a drug and they eat half as much as they should, that it's not just calories, it's not enough nutrients. So basically what we're going to need continue to have diets where they're much more nutrient dense, if you like, relative to the energy.
So it's almost the opposite what we're doing now. Kind of.
Well, it's the diets are actually bizarrely, other than say fiber, I suspect the diets will be similar, but they may be higher in fat actually as well. Because you basically need to be sure that if they're eating less, they're going to consume, say, about 50% of what they need, and then they'll lose weight. But in that 50% of what they need to be consuming 100% of amino acids, 100% of vitamins. So basically, relative to energy, they're going to be quite dense, just to make sure that they can kind of consume sufficient. The alternative is you take a kind of standard pet food, but you feed some kind of supplement. So it'll be almost like a protein boost that you'd give alongside it, or a vitamin mineral boost or something like that. So I think there's there's going to be a lot of innovation required once drugs come, and assuming they do work as effectively as they do.
So that's great. I mean, that's a very important thing for the pet food industry to look into this space. So, but are there some clinical trials already that you're aware of, or do you have personal experiences with those new drugs?
I'll tell you that historically, I'll tell you that there were some drugs available many years ago. You may be old enough to remember. We had a drug called Dilotipide, or Slentrol was the trade name. This would be about 20 years ago now. I think 20 years ago it came out. And there was a similar one, Metratipide or Yarvatan, that was also licensed in Europe. And they actually, in terms of evidence, there were a lot of detailed trials done with both those drugs, and they were very effective drugs. It was just, I think the time wasn't right. Owners weren't willing to accept drugs for obesity in dogs, and nor were vets. So they kind of largely didn't quite take off. It's possible those drugs could make a comeback. And we know, therefore, that they work and they were generally pretty safe for dogs. As for the kind of, are there trials of the newer drugs? I'm aware of people doing them at the moment. I don't know that I can say too much more than that, but certainly people are, I think, working on them to see how effective and whether or not they'll be.
But at this point, we don't have any data yet
There's a very recent study come out, but not with semaglutide or any others. One of the very older agents, I think it's liraglutide. So there's one that's literally, I think, been published in the last month or two. And it's not a very effective drug by and large, so I'm not quite sure what the reason was for using that particular one, but it did show that there was some weight loss at the time. I think there were some concerns about food consumption and whether or not they effectively would be consuming sufficient protein. So I don't think, as I say, I think the comments I made earlier about drug therapies will certainly be pertinent now. That's the only one I think I'm aware that's been published, but certainly I know of others working on some of the newer agents as well.
It's time for our famous three.
For more than 20 years, BioOrigin manufactures high-quality yeast-based ingredients through a sustainable biotechnological process, guaranteeing full traceability from the crop to the bowl. Through specialization in the fermentation process, BioOrigin brings the right solution for specific nutritional, palatability, and health appeals, such as gut health, immune system, skin health, weight control, and more. BioOrigin's products are natural origin, non-GMO, and certified sustainable by Bonsucro. BioOrigin is your partner for high-quality, yeast-based ingredients to add value to pet foods worldwide. Learn more at bioorigin.net.
So for the time being, we kind of running already, good on time, but two more questions. One of them is, since we're still waiting for drugs, right? What is now you think would be the diet's approach that you would think that you would see has the highest success rate?
Right. Yeah, sure. So, I mean, the good news is we have a lot of data there. The best foods we have on the market are the therapeutic diets and those that have both high protein and fiber content. Okay. This is particularly useful for dogs because both protein and fiber act on satiety and therefore make it kind of feel fuller. Because one of the major challenges with any kind of diet-based plan is that as soon as you start cutting the calories, the dogs feel hungrier, and then they kind of start asking for more food seeking, and that can be a major challenge for an owner in terms of addressing and preventing, not giving in, as it were. So there are some very good food advice. I'm not going to kind of mention any particular product names, but there are a number of diets that fit very much that purpose. If you feed them according to the plan, the amounts there, then you can pretty successfully get weight loss. And interestingly, the kind of typical amounts of weight loss achieved are similar to what people have on the drugs. So we might actually find that the drug therapies, are provide an alternative, but it might simply be giving us alternatives. So some people might choose to carry on going on a diet-based approach. Others might try the drug, and there's an opportunity potentially to mix and match. And the other thing, of course, we say about the drugs is they're only effective for as long as they are being taken. And so we still need solutions to avoid any rebound. We've had studies where we know that both dogs and cats, once you stop a diet-based plan, there's a risk of them rebounding. The same will be true if you're using drug therapies. As soon as you stop the drug, like in people, there's a tendency to regain weight. So even if you've used drug therapies for the weight loss bit, you still will probably need to use one of the kind of standard therapeutic diets for the maintenance period afterwards.
Can I ask you for like a very kind of final quick tip for like treats? So what do you recommend? Because owners, obviously compliance is a big thing, and owners want to give treats. What do you kind of recommend as treats in those weight loss diets?
Yeah, it's a great question. The ideal is not to give treats, and this again is with a kind of conventional diet plan. But owners always need that. It's a way they show love. You can sometimes get some owners, if for example they're on a dry food, a kind of kibble-based food, that you can have a kind of treat portion of that, because often for dogs it's the act of receiving the treat they crave rather than, it doesn't really matter so much what it is. So that can sometimes work, but a lot of owners want it to be something different. You have to take into account the treat within the overall calorie intake. It can't be on top of that. So if it's something different, my number one actually is, believe it or not, zucchini. Yeah, a watery vegetable. Dogs will eat pretty much anything, so there's never any problem with them. Believe it or not, cats will eat zucchini as well. So if you take the skin off and you steam it or microwave it, it kind of goes a little bit mushy. I wouldn't say every single cat, but I would say the majority eat it and often consume it quite readily. It's not that it has 0 calories, but it's very, very kind of calorie light. So the advantage is that you can feed quite a lot of that, and it's not going to make a big difference to a diet plan.
That sounds great. I've never heard about zucchini.
And it brings water as well, which can sometimes have advantages for other medical problems. There's some evidence that water increases activity in cats as well. So
let me ask you for the last 1 or 2 minutes, the future, right? Especially about your research and what are you working on that you can disclose. And what makes you excited that you think is, that you really think it may change based on your research in the future? What we do?
There's always far more questions to answer you'll be like me. I never answer a question. I always just create further questions through my research. So that's kind of convenient. A lot of what we've been working on recently, interestingly, is the link between obesity and diabetes in dogs and cats. So we've been firstly looking at, is there a causal association? There are a number of studies suggesting that in both dogs and perhaps surprisingly both cats and surprisingly dogs, and also that obesity is associated with diabetes. We've just recently, actually, at the conference, the ECVIM conference we both attended, we presented an abstract where we looked at prior obesity. So we looked at cases that had diabetes, their medical records, and we reviewed a period of at least 4 years before they developed diabetes and looked at their body condition score in that time. And we compared those with control cases that were otherwise identical without the diabetes, similar period of monitoring. And interestingly, not only the presence of obesity before diabetes was linked, but the longer they were in an obese condition, the greater the odds they would go on and develop diabetes. So that's kind of both a temporal association and a dose-response relationship, as it were. So it's probably the strongest circumstantial evidence that there is indeed a link, and possibly a causal link then. So we've been looking at that. We've also been looking at, in cats, remission of diabetes if you have obesity as well. So people know cats get a kind of insulin-resistant form, a type 2 diabetes, as it were. We know that obesity leads to insulin resistance. So not surprisingly, if you've got a cat that's got diabetes and obesity concurrently, it's long been suggested if you can get that sort of cat to lose weight, they might go into remission. It might surprise people that there's not a single study to date looking at that. It's suggested, but it's never been proven. But again, at this conference, we've just presented the results of a randomized trial where we looked at caloric restriction in diabetic overweight cats. And spoiler alert, if they lost weight using the caloric restriction, their odds of going into remission were greater. So that's the kind of stuff we've been looking at.
So that's wonderful. So that's the kind of that's the point of obesity care, I guess, right?
Yeah, agreed. Yes, thank you. I've taught you well there.
So I'm very sorry, but we're at the end of our episodes. So Alex, thank you so much. It was really, really insightful. I think it really expands the spectrum, what we can do in the future. And also, still very important, pet food is kind of the basis of everything, right? Even you can have those drugs. Yeah. So with those, thank you so much, Alex. And that concludes another episode of the Pet Food Science Podcast, presented to you by Wisenetics. Thank you for joining us today. Don't forget to subscribe to our podcast to stay updated on future episodes. And if you enjoyed this episode, please leave us a review. Your feedback is very invaluable to us. Until next time, this is Jan Sugadolski from the Pet Food Science Podcast signing off.